Over the last week, I've spent time on the phone with Arizonans who've reached out to my office to share what these tax credits mean for them and what also happens when they go away. I want to share a few stories from these folks who are already bracing for the worst. Because if anyone here is still wondering what this debate is about, this is it. So I talked to a guy named Rusty from Tucson. He's a cancer survivor. He runs his own small business in Tucson. He also takes care of his mother, who is in memory care. He told me, this is a quote, "I've been using the marketplace for years. Last year I paid $277 a month for my plan. I've now been told my premiums could jump to between $450 and $600 a month. I have to have health insurance," he said. "But there's really no way I can afford what is about to happen." Rusty's not asking for anything extraordinary. He's asking to keep what's already working for him, the ability to afford care while he works hard and contributes to his community. Robin, who is 60 years old, she lives in northern Arizona and is trying to save for retirement. She said, and this is another quote from Robin, "These subsidies have been crucial in making health insurance affordable. I am struggling to pay for my living expenses as it is." Now, Robin doesn't qualify for Medicaid, but she does work hard. She just wants to be able to afford health insurance until she reaches Medicare eligibility. And Robin said she is not looking for a handout. She is looking for a hand up. Cricket, who is 63, is a realtor from Phoenix. She's self-employed and not yet eligible for Medicare. So for the past 8 years, she has relied on the Affordable Care Act for her health coverage, and if the tax credits go away, her coverage will become unaffordable. She told me, this is a quote again from Cricket, "Without it, I would have faced bankruptcy. If premiums rise or these subsidies go away, I could lose my home and everything I've worked for. Health care shouldn't be a privilege, it's a right." Daylene from Casa Grande was diagnosed with congestive heart failure 20 years ago when she turned 40. Doctors told her that she might live 1 or 2 years. She said because of these credits, she has been able to afford her insurance and medication that literally keeps her heart beating. She wrote to us, "My monthly cardiac drugs cost alone would be over $2,000 without my insurance from the ACA." She continued to tell me that these credits gave her more than health care. It gave her freedom to leave an abusive marriage because before that she relied on her husband to afford her health care. That's what this is about. When people can't afford health care, they stay in situations they shouldn't stay in just to keep their coverage. A job they don't want, a city they do not want to live in, maybe farther from family, and in the worst case, an abusive relationship because they need affordable coverage. Survival, dignity, and freedom, that's what we are talking about here when we talk about affordable health insurance and care. In Arizona, Mr. President, people like Rusty and Cricket and Daylene and Robin, they do not have lobbyists. What they have is faith that when they write their senator, someone will listen. I'm not just listening, I'm fighting for them, and thousands more across my state who are in the same exact position.